Chairperson, Dr. Louise Mapel-Poto, Honorable Ministers, Dr. Chikwe Kuhezu, Regional Director, ADIM, Interim, ladies and gentlemen, all protocols observed. A very good afternoon. Bonjour, bon dia, jambo. At the outset, allow me to begin by thanking the WHO Afro-Region Committee for giving me the rare opportunity and privilege to be one of the contestants for the position of the Regional Director. I would like also to pay tribute to a truly distinguished colleague, Dr. Faustin Dungulile, the former Regional Director-elect. His ultimate passing is what necessitated this electoral process. His memory will continue to inspire us. I sincerely thank every one of you who offered their condolences. Honorable Chairperson, as introduced, I am Professor Mohamed Yakub Janabi. I bring with me 30 years of experience in health and leadership. From humble beginnings as a young GP, I rose through the ranks to become a prominent healthcare executive, public health specialist, a cardiologist, scientist, health diplomat, a researcher, academician, and author. I'm very much aware of the health challenges facing the people of our continent. I've lived them. I'm currently dealing with them every day during my practice. Honorable Chairperson, in my extensive work in public health and leadership, I've always been driven by the vision and ambition to have a healthier, more resilient, and prosperous Africa. I believe I can make important contributions if elected, guided by Sustainable Development Goals, Global Program of Work 14, and Africa Health Strategy. I uphold health as a human right for all, including people with disabilities, while embracing gender equity and equality. I'm committed to ensuring universal access to quality healthcare and strengthening health systems to meet the needs of the present and future generation. Honorable Chairperson, I commend the WHO in collaboration with the government and other stakeholders for its outstanding work in improving health outcomes and well-being, as evidenced by the significant progress made across various health indicators. However, today, Africa stands at a turning point in its history because of the complex challenges that call for an urgent and collective action. These include financial crises we see, geopolitical instability, impacts of climate change, infodemics, the growing issue of antimicrobial resistance, the pressing realities of pandemics, and other public health emergencies. Honorable Chairperson, I've been a senior advisor on health policy and nutrition to the former President Jakaya Kikwete for 10 years, from 2005 to 2015, and currently to President Samia Suluhu Hassan. I've had the opportunity to advise the highest political office in our country on the transformative needs in the health sector. This position has allowed me to spearhead initiatives which have impacted positively in the fight against health crises and establishment of systems that continue to deliver tangible results. So what qualifies me for this service opportunity? I believe that Africa, where it stands today, deserves a leader who not only has the vision, but also the proven ability to deliver results with efficiency and transparency. The challenges we face as a region today demand a bold and practical leadership, someone who understands the realities on the ground, someone who can work with government and other stakeholders to mobilize resources, and someone who can create tangible partnership to address them. I believe I'm such a leader. During my practice, I've witnessed people missing out on healthcare for lack of finance, and families parting ways with their possessions, the very means of livelihood, just to pay hospital bills. Yet, despite making these heartbreak sacrifices, many still find themselves trapped in debt and poor health conditions. For me, this is a harrowing experience. Out-of-pocket healthcare costs have pushed countless families into the depths of extreme poverty, thereby recycling poverty. This requires urgent solution. I believe universal care is the solution. Honorable Chairperson, I have a long experience in training, research, and working abroad, followed by many years of hands-on fieldwork across the African region. Throughout my career, I have worked with heads of states, ministers, parliamentarians, community health workers, philanthropies, private sectors, NGO, civil societies, financial institutions, and faith-based organizations. My track record includes transforming healthcare systems from the ground up, even in the extremely challenging and resource-constrained environments. How did we do it? By pioneering innovative healthcare financing, building a stronger health workforce, building infrastructure, initiating outreach services, and successfully managing public health emergencies. So what gives me assurance in my track record? Trust is built on results. My contribution to healthcare is undeniable. I understand the challenges ahead. I bring the new resolve to address them. I'm not only ready for this challenge, but also uniquely equipped to address them and deliver the transformative change our continent urgently needs and expects from us. Having visited many member states, over 30, I recognize the urgent need for a fundamental shift in how WHO Afro responds to specific country needs. I will drive this transformation, ensuring a more agile, country-focused, country-owned, and impactful organization. Chairperson, now I would like to highlight some key personal experiences and achievement. My first point is on strengthening health system. As the founder and first CEO of the Kikwete Cardiac Institute in 2014, we were able to reduce overseas referrals by 95%, saving the country more than $10 million per year. The funds saved are now being reinvested in strengthening PHC and financing patients who cannot afford hospital bills. Again, how did we do it? By building in-house human capacity, investing on infrastructure, advocating for an increase of health budgets, engaging private sector, financial institutions, and fostering global collaboration. The Institute has become a regional hub that performs more than 4,000 intervention procedures and open heart surgeries annually, ranging from pacemaker insertion to bypass surgery. Currently, it serves patients from across Africa. Honorable Chairperson, in 2022, I was appointed CEO of Muhimbili National Hospital, one of the largest hospitals in the region with 2,400 beds and 4,000 staff under me. The hospital attendance on average is 3,000 patients per day. Furthermore, I oversee an outreach to a network of 12,200 satellite healthcare facilities across the countries through telemedicine, e-medicine, and artificial intelligence. Our plan is to build a brigade of 137,000 community health workers by 2030. These workers are going to serve as a bridge between the community whom we serve and the formal healthcare system. Honorable Chairperson, this year in January, under my leadership, we secured $363 million from a non-traditional financer, the Republic of South Korea, for health system strengthening on favorable terms of 0.01% interest, 15-year grace period, and 25-year repayment. This innovative financing will transform Muhimbili and its satellite facilities into a regional hub for preventive, protective, curative, and rehabilitative services, aligning very well with the GPW 14 objectives. If elected, I will endeavor to engage such non-traditional funders from within our region and outside the continent. In the research and advocacy domains, I co-investigated HIV vaccine trials in Tanzania and Mozambique in the early 2000s. Later, in 2012, my advocacy led to the then sitting President Jakaya Kikwete to publicly undergo HIV testing. This reduced stigma inspired 5 million Tanzanians to seek counseling and testing within a year. Likewise, the story repeated itself. In 2021, President Samia Suluhu Hassan openly championed and publicly received the COVID-19 vaccine, significantly increasing its uptake across the country and reducing infodemics. My second point is emergency preparedness. In 2015, the UN Secretary General Ban Ki-moon appointed President Kikwete to lead a UN high-level panel on global health crises after the Ebola outbreak in West Africa. As a senior advisor, I visited the affected countries of Liberia, Guinea, and Sierra Leone, gaining invaluable hands-on experience, and the panel's recommendation contributed to the efforts to transform the WHO approach to managing emergency crises that we observe today. My third point is on demographic response. The African continent is experiencing a demographic transition with its youthful population, offering both opportunities and challenges. Now, when you have a young population, it can drive growth and innovation. It's also highly exposed to risk factors such as substance abuse, unprotected sex, teenager pregnancy, mental health disorders, to mention a few. On the other side, as the population ages, it is crucial to prepare our healthcare systems to address the needs of older generation. My fourth point is on fresh perspective. I am ready to champion fresh ideas and innovative approaches that can revitalize our organization and drive impactful reforms. My work in Tanzania, advancing PHC, along with my experience abroad, has given me a first-hand insight into the barriers to healthcare access and their profound impact on our communities. Honorable Chairperson, the challenges ahead are so broad and multifaceted. A member state or any organization cannot manage on their own. To address them effectively, we must act together in bilateral and multilateral relationship. I am committed to addressing the challenges by focusing on my 7 key priorities presented in no particular order. My first priority is universal health coverage and the SDGs. With less than 5 years remaining to achieve the SDGs, many indicators show we are off track on achieving them. In our region, for example, the universal health service today is 46, while the global index, 68. Globally, today, 4.5 billion people lack full access to essential health services, half of the world, with 1 billion experiencing catastrophic out-of-pocket expenses, pushing families into poverty. I'm committed to the achievement of universal health coverage. My second priority is sustainable financing. Our current financing model faces persistent challenges, worsened now by the acute shift of global financing policies. Currently, 80% of the WHO budget relies on voluntary contribution, many of which limit our autonomy of earmarking because of earmarking. Member states' assessed contribution is only 20%, and sometimes even less. So sincerely, I support efforts to increase the assessed contribution, which is going on. As for supporting member states mitigating the catastrophic decline in external funding, I will work with governments to secure diversified funding through health insurance schemes, public-private partnership, blended financing, debt for health swaps, and global debt cancellation. This will help bridge resource gaps and offers our region a valuable opportunity to establish a resilient, self-sustained health financing system. My third priority is strengthening emergency preparedness. We must strengthen our health system through strong health workforce, disease surveillance, intelligence system, enhanced rapid response mechanism, cross-border cooperation, and sharing the best practices. My priority will include championing of implementation of the amended IHR and supporting the development and implementation of the pandemic accord. My fourth priority is maternal child health and nutrition. Africa bears 70% of the maternal deaths, 56% of under 5 deaths worldwide. Additionally, the high prevalence of stunting compounds these challenges with profound implications for the continent. However, amidst these grim statistics, there is a beacon of hope. In Tanzania, maternal mortality dropped by an impressive 80% between 2015 and 2022, a testament to the transformative power of primary health care and strong political commitment. In recognition of her able leadership in this, President Samia Suluhu Hassan was awarded the prestigious Goalkeeper Award in 2024. My fifth priority is combating communicable, non-communicable, and neglected tropical disease. Through robust disease control strategies, promotion of healthier lifestyle, and a One Health approach that recognizes interconnectedness of human, animal, plant, and the ecosystem, I will work with the governments and partners to address the high burden of these diseases by implementing a comprehensive cross-sector strategies for prevention and control. My sixth priority is tackling antimicrobial resistance. Now, this is a crisis unfolding in a slow motion. Currently, it's responsible for 1.2 million deaths annually. This is compounded by the lack of surveillance data in 40% of our member states, leaving gaps in understanding the extent of the problem. I will support the establishment of the regional databases and efforts to combat the crisis. My seventh priority is building local manufacturing capacity. What did COVID teach us? COVID revealed critical gaps in our local capacity to manufacture diagnostics, therapeutics, and vaccines. Over 90% of these public health products are imported, and this heavy reliance poses a significant threat to our region, to both supply chain stability and health security. Hence, boosting local production is the key to economic growth. I believe it's high time to involve our non-traditional partners, including the diaspora healthcare world, who can contribute significantly through expertise, training, and mentorship, thereby strengthening health systems and promoting sustainable development. I'm a living example. I'm a Tanzanian diaspora. I will leverage health diplomacy to catalyze health system strengthening, partnership, and elevating Africa leadership in global health governance. Honorable Chairperson, allow me to conclude by extending my heartfelt congratulations to Dr. Moet and our team for the inspiring leadership and outstanding contribution, to all WHO Afro member states, WHO staff at all levels, and collaborating partners. If elected, I look forward to working with you. I extend my profound gratitude to President Samia Suluhu Hassan for placing her trust in me. I humbly ask you for your vote on the 18th of May 2025. Together, we can shape a brighter future for Africa. Together, we can have the power to transform our mother Africa. Thank you. Merci beaucoup. Muito obrigado. Asanteni sana.
Thank you, Professor Yakub. We'll now continue the interview with questions and answers. I will now pull the first token with the name of the regional committee member which expressed their wish to ask a question to Professor Yakub. Côte d'Ivoire.
Savoir expérience dans la gestion des urgences au niveau
to find out more about the management of emergencies.
votre stratégie répondre aux différentes urgences qu'on a.
What would your strategy be to respond to the various emergencies? Speaker's sound is intermittent. We apologize. Perhaps the honorable delegate from Côte d'Ivoire could adjust his sound.
So can we come back to Côte d'Ivoire after we ask another member state to ask a question?
Je suis audible maintenant.
I will now give the floor to Ghana to ask the question. Ghana.
Hello.
Ghana. Ghana, you
Yes, I just want to thank you for the opportunity to ask this question from the Ghana team to our candidate. Want to thank you for the lucid presentation. But straight to the point, I just want to ask Prof, in a brief sentence, what legacy would you like to leave as WHO Africa leader who is trying to lead the region? And also, how would you measure the impact of your leadership on the health and the well-being of the people of Africa? As our leader for the region, and how would you measure the impact of your leadership on the well-being of our people in the African continent? Thank you very much.
Honorable Chairperson, thank you for the question. A very good question from Ghana. My answer with this, what legacy do I want to bring? The first thing, I'm trying to look what is happening to the world today, what is happening to our region today. One of the things which I'm going to leave after my 5 years or 10 years, depending, is to leave our continent dependent, self-sufficient, by domestic financing, innovative way. I want to see, as I said, 4.5 billion people are pushed into poverty. Majority of these people live in our continent. It concerns me. Do we have a way to get out of this? Yes. By being independent, by increasing our workforce. We have to invest on community health workers. Because if we are talking of primary health care, which is a backbone of universal health coverage, we have to prevent the disease. And the only way we can do it is by strengthening Africa workforce for transformation. I would employ innovative strategies to build a resilient health workforce, particularly the community level, empower the community health workers, enhance retention and motivation. Why our people are leaving? Motivation, one of them, infrastructure has to be better, has to be equipped. by task shifting. We have to invest on education and research, expanding, because we are talking of evidence-based medicine. We have to foster on our regional collaboration. I'm going to invest on mapping. What is Ghana having, which Tanzania doesn't have? What is ECOWAS having, which East African Community doesn't have it? Or the regional economic communities. We have to work with Africa CDC, the African Union, and strengthen our policies, which will help countries to develop national workforce strategies, advocate on increased government support and resources for health. Look at Abuja Declaration, more than 2 decades now. So what can we do? And in order to fill the gap, one of the approaches which I suggested in my manifesto, we have to have a discussion on debt relief. Because now, our region, we are using a lot of money servicing the debts. Can we do debt swaps? Debt for health? So these are very crucial. But if you look on what is happening now, I think one among is planning. What actions can be taken immediately?
Thank you for answering the question. Can we go back to Ivory Coast? Ivory Coast, are you ready?
La Côte d'Ivoire est prête. Est-ce que vous m'entendez correctement?
Côte d'Ivoire is ready. Can you hear me clearly? Asks the speaker. Thank you.
Yes, we are hearing you.
I would like to ask a question to the colleague from Tanzania. What is your experience in handling health emergencies? And what would your strategy be to responding to the numerous emerging emergencies like Mpox, EVD, cholera, that are linked to political and health crises? So I'm talking about emergencies in our various countries. Thank you very much.
Honorable Chairperson, Honorable Minister from Côte d'Ivoire, addressing health securities, threats such as pandemics, which you have just imagined, imaging diseases, antimicrobial, it requires a robust leadership, a coordinated one with a One Health approach, and very well-resourced systems to effectively detection and response. Now, I'm a living example. 2023, Tanzania had Marburg. This year, the one which I'm talking, we have Mpox, which we have just declared. So what have we done? First is strengthening our health security system. So we're collaborating with member states to build capacities in disease surveillance, laboratory and diagnostics, rapid response, and this is exactly what we did. We had regular simulation, and after action reviews, we had a lot of stockpiles in the regional, so we didn't have to run. I'm living in Dar es Salaam, for example. The place where Marburg occurred is 1,400 kilometers. So enhancing the regional stockpiles, logistic enhancement, it helped very much in managing Marburg and Mpox outbreaks in 2023 and 2025. The regional collaboration is very important because in October, there was an outbreak in Rwanda. So we have to approach it in a multi-sectorial way, in a One Health approach. Building our own capacities, this is very important. Health workers development, scalable emergency response system. I spoke about fostering the regional and international collaboration, monitoring, ensuring accountability, and establishing metrics for preparedness. So engaging the community and the risk communication, it's very crucial in facing the pandemics. Because of time, I haven't spoken about antimicrobial resistance, which is another crisis in our region for any epidemic which will come. So it's all about preparedness, about the surveillance. I spoke in my manifesto. We have to increase the intelligence which will help us in rapid response.
I shall now give the floor to Guinea to ask the question. Guinea, are you there? Guinea, can you kindly unmute yourself? Guinea? Please check and see if you are muted. I will select another member state and come back to Guinea later. I will now give the floor to...
Thank you, Dr. Janabi, for the presentation. The looming challenge of antiretroviral therapy following the United States government promulgation is a reality. What measures can be put in place to ensure equitable access to ARVs for the marginalized population, especially the low resistance in low resource settings? Secondly, how all changes in policy affect the affordability of ARVs and patients, and what can be done to mitigate from the financial barriers created? Thank you.
Madam Chairperson, I missed the first part of the question. Is it on financing on the ARVs? Can the question be repeated, please?
Okay. Sorry. What measures can be put in place to ensure equitable access to ARVs for the marginalized population, especially in the low resource settings? Thank you.
Thank you, Madam Chairperson. Thank you, Minister or Delegate from Zimbabwe, for the question, what can we do to put in place for the marginalized people who are very important, and is in my manifesto too. So I think the first thing I'll go to is address the primary health care. Because where do these people live is in the community. So addressing primary health care and universal health coverage requires a comprehensive approach. I do have first-hand experience working with two presidents, 13, 14 years now. Just to cite a few examples, the past few years, we have built about, around more than 8,000 centers. So what do these centers do? One, it will strengthen the foundation of PHCs, invest in community health workers, equip the primary health care facilities, promote telemedicine where it's far to reach these digital people. But crucial, which we are in crisis now, advocate for increased domestic financing. Budget allocation, encourage the government to allocate the Abuja Declaration, which was 15%. Improve accessibility and equity. Establish more primary healthcare facilities and mobile clinics in remote areas to support the national insurance schemes for the vulnerable. We have to strengthen the health system for resilience. You need workforce development, data-driven decision-making. We have to accelerate towards universal health coverage. Our policies, our legal frameworks to support an embedded universal health coverage principles in the health policies. We have to foster a multi-collaboration. But for example, Madam Chair, if allowed, what we have done quickly after this crisis to try to look these vertical programs. I don't say all vertical programs are bad, but can they be integrated to our normal services? Because it will bring these patients to our normal systems, which are funded by most of the government. So adaptation, I will really discuss on the flexibility when crises or challenges happen, whether it's a pandemic or a climate change. So we have to have a very resilient system which can cope not only with the climate change, but like the financial crisis which has just happened. How can we cope fast? How can we adapt with the situation?
We will now ask Guinea if you are available. Can you come back and give your question? Kindly unmute yourself, Guinea Conakry. If Guinea is not available, I will.
Allô? Allô?
Yes, hello?
Allô?
We can hear you.
Oui, allô? Oui, bonjour à tous. Félicitations.
Greetings to everyone, and I'd like to congratulate all the candidates who've made their presentation. I'm the Minister of Health from Guinea. I hope you can hear me. Can you hear me? Kindly confirm.
Yes, we are hearing you.
D'accord, vous m'entendez?
Thank you. I have a question for the candidate regarding financing of the health sector. From 2001 in Abuja, governments were supposed to allocate 15% of their national budget to health. Unfortunately, not all countries have honored the 15% pledge. What strategy would you as a candidate put in place to ensure that countries commit to the 15% allocation to the health sector? It's just the first question. My second question is the coordination of...
Guinea Conakry, you are permits me to kindly ask you, you are entitled to only one question. I'm sorry, just one question.
Okay. Thank you.
Thank you, Honorable Chairperson. Thank you, Minister from Guinea Conakry, for a very valid and important question to our region. It's true, Abuja Declaration requested our countries, respective countries, to finance at least 15% from our budget. So it's if elected, our member states are 47. Not all of them are equally in economic sense. So I think the first thing which I would like to do is a country specific. Honorable Minister, I will listen to you. I will talk to you. So I will go for each country specific. For example, there are countries I'm going to engage them in strategic resource mobilization. Work to diversify our funding sources by engaging both our traditional and non-traditional, including international donors, the private sector, the philanthropic organization. So I would advocate for increasing the domestic budget. I've discussed a little bit about what happens with our debt. Can we discuss about cancellation or swap of the debt? Because how much our countries are spending on servicing the debt. Can I take that fund and put it in the 15% which is greater? I will foster the public-private partnership to bring an additional source for our health, which automatically will secure our health security. How will enhance coordination and international partners? We have to strengthen our partnership with the multi-organizations like Gavi, the Global Fund, and other UN agencies. The African Union is there. Support on innovative in resource utilization. We have to encourage adoption of innovative, cost-effective solutions to maximize the use of the little available resources we have. We have to strengthen our monitoring and accountability. One of the things which our partners sometimes worry is our accountability. Can we be more transparent? Can we do more audit to our accounts? Can we put our accounts open so that we can build the faith or the trust which our donors sometimes do? But whichever way we want to look, the innovative domestic funding, we just got a wake-up call with the current crisis which is happening. I think we have to look at it in a more wider. We have recently 40% of the minerals are from our continent. How much are we using it? Added value, levies, can we direct this fund to the health? So I think, Honorable Minister, I'll come to you with great humility. I will listen to you. I will listen to your advice. But together, I think there is a way for our region to be more financially self-sufficient. Thank you, Madam Chair.
Time for this interview has been exhausted. Thank you very much, Professor Yako, for being with us today. We'll now proceed with the interview of Professor Mustapha Majiyawa, proposed by Togo.